In paper 2 of the thesis, we investigated, similarly to paper 1 in South Africa, we investigated the incidence, etiology, and injury characteristics of traumatic spinal cord injured individuals in Stockholm, Sweden. So we followed a similar approach to the previous study, where it was population based, and we included all newly individuals for not 1 year but for an 18-month period, and this was coordinated by the Spinal Cord Injury Unit at Karolinska University Hospital in Solna. So we found that the incidence in Sweden was 19 per million. When we compare this with the previous study that was conducted 10 years ago, it seems that the incidence of spinal cord injuries remained stable over the last decade. We found that the median age was 58 years of age at the time of injury, and this is also higher compared with the previous study conducted 10 years ago, where the median age was 47. The causes of injury this time was limited to fall-related events, accounting for 58% of all cases, and transport-related events, which accounted for 40%. There were ever no assault cases and only 1 sport-related injuries. Concerning injury severity, most of the individuals had tetraplegia. Now I want to compare the findings from paper 1, the South African incidence study, and the Swedish incidence study. When we compare the incidence, we found that there's a 4-fold difference in incidence between the 2 countries. We also found that there are significantly different ages in these 2 contexts, with the South African cohort being at mean age 20 years younger than the cohort in Stockholm. So, are these 2 cohorts comparable? We also found that there are significant differences in the distribution of cases across the cause categories, with no assault cases in Sweden. But what we found that there was no significant difference in the injury severity between these 2 cohorts, and we also found no differences in associated injuries, those concomitant injuries that happen simultaneously with the spinal cord injury. And this is very surprising, since the cohort in South Africa were usually injured via gunshot wounds, which are high velocity injuries compared with low velocity injuries occurring in Sweden, Stockholm. We also found that more individuals in Stockholm received spinal surgery, and also the time to surgery was significantly shorter in Sweden, and this is a sign of good practice. So we found that there are differences and also similarities between the 2 incidence cohorts. So future work will look at the care pathways, how individuals move through the chain of care, and also look at the outcomes obtained during the chain of care. Thank you.